Well, hello, everybody. It's good to be with you again. This is our Wednesday medical update. I've come to really enjoy this time with Beth Moss, who's our parish nurse, a medical professional. Something that people may not realize that Beth has to maintain every year. She has to maintain her credentials through study, research, training, continuing education. So Beth is very current. And Beth, it's just great to have you with us today. We're going to go ahead and move straight into really the subject for today. I think as conversations kind of move from mitigation of COVID-19 to, I don't know what the word is for reopening, but we'll just call it that, from mitigation to reopening. There's several things that people are asking. I want to rifle through a couple of these. But first, I know that as you present this information, you spend your time now when you used to spend it visiting so many people. Now you're spending a lot of your time reading through reports and finding those credible sources. And so the information that Beth is giving us, everybody, is coming from some really good resources. And thanks, Beth, for bringing all that to us. I think one of the things that we've heard most recently, at least earlier this week in Mecklenburg County, Bethel is in Mecklenburg County, is that we're not going to be peaking until late June. That's what the latest modeling shows us. And we know that models are flexible, but within a very broad parameters, they're fairly spot on. And when people refer to peak, would like to know, what do they actually mean by that word peak? And maybe what are some of the implications for people in Mecklenburg?
Well, I think it is important to look at that model that's specific to Mecklenburg County. We have twice the amount of reported cases per capita than the whole state of North Carolina. So I think it's important to look at that model because it's specific to just our county. When they're talking about peaking, that is when the numbers of people who need care versus the availability of the care that they need, whether it be in-house regular beds or ICU beds. So what that latest model said, that if 45% of the people continue to social distance beyond what's mandated currently, we will peak June 27th, meaning that's when the most sick people in proportion to the beds. If only 30% of those people social distance, we're going to peak earlier on June the 16th. We're likely not going to have enough critical care beds, ICU beds in our county to handle that influx of patients. If 60% of the people still social distance beyond those numbers, we're not going to peak until July the 17th. So that's going to bring down the curve, spread out the instances of infection.
Thanks for that explanation. I think there is a little bit of a misunderstanding about what it means to peak. And so I think that is very helpful. And we'll make reference to that study, Beth. We'll make that available as one of the links to today's update. So thanks for that. As people talk about reopening, there was a report out from Johns Hopkins University this week that can outline some very broad parameters. It wasn't so much a plan as it gave us really sense of how to understand what reopening means and several factors for that. What, as you've read it, what are just maybe a couple of the takeaways for you that stand out?
There weren't particular dates in the Johns Hopkins report. It was phases. Yeah. And in order to shift into phase 2, which is, phase 1 is the physical social distancing, which is working. But in order to shift into phase 2, they said there's 4 points that have to be considered. The number of new cases has to decline for at least 14 days. Number Two is the rapid diagnostic testing capacity needs to be sufficient to test. We don't have that yet. They're still working on that, and UNC just got some federal funding for that yesterday. The third thing that needs to happen is the healthcare system needs to be able to safely care for all the patients and have appropriate personal protective equipment. That's the PPE that everybody is using. That's the protective equipment. That's gowns, masks, gloves. And all you see is there's not enough. And number 4, there needs to be sufficient public health capacity to conduct contact tracing for all new cases and their close contacts. I read an article just this morning that the estimate is we need 100,000 more people employed to do that, to do the contact tracing.
That's amazing. Wow. 100,000.
100,000.
Well,
that's just to go into phase 2. Okay. And then phase 3 looks ahead to a time of effective therapeutic or vaccine availability. That vaccine availability at least a year out.
Right. Okay. So when we talk about phase 1, phase 2, phase 3, I know there's a lot there. Okay. Where do churches typically fit into? Where do you find churches? How are churches being referenced in all this?
Okay. In that Johns Hopkins report, they were looking backwards because this is so new. You only have to study what happened to predict what's going to happen. Religious organizations, religious services are categorized as super spreaders, meaning that's where a lot of these outbreaks are happening when churches gather, do services. And I found it interesting that in that super spreader category is also cruise ships, long-term care facilities. So we are high risk for spreading this disease if we get back together.
I think that's a very good word, and that's a strong word, and certainly something that I know Bethel leadership and other church leaders are going to be taking into consideration as we think about reopening, which we're going to be considering. A session on Tuesday, this coming Tuesday is meeting. I know several of the leaders are meeting, the chairs and staff, a couple of other churches joining in for the conversation with you and the other part of the medical team. That'll likely happen either Thursday or Friday this week. And so these are good things that we're going to be talking about, and any decision we make will be rooted firmly in this, in the data and the science and what you all are recommending. But let's think about the church just for a moment. When we do resume normal activity, and maybe especially corporate worship, because that's our biggest unifying piece there, what in your mind would you be wanting to emphasize?
Well, we still need to social distance. And, there needs to be a lot of thought into how do you have a worship service at 6 feet apart. That is the thing that's going to help the most. We also need, we're going to have to discourage any hugging, handshaking. I mean, that's what we as covenant partners do. We care for each other, and that's been our normal up to about 6 weeks ago. That's all changed. We're going to have to think about wearing those fabric masks when we're together. We need to think about how are we going to sanitize our facility. It can't be just after the service we have a cleaning crew go in and sanitize. It has to be during. We've got people going in and out of doors, in and out of bathrooms, and the CDC has specific guidelines for communities of faith. And it even goes down to sanitizing all the light switches frequently, all the doorknobs, all the hard surfaces. And you think of a facility our size, that we really need to think about how are we going to do that.
Yeah, and I think we'll be just thanks for that, because I wanted people to hear the types of considerations that we need to make. When we make a decision as leaders for a church, we're having to think through all kinds of dimensions. And it's not just, oh, we want to get back together again, so let's do it. And there's a whole science bit here, and several guidelines that we're going to have to make sure we can adhere to. And thanks for the wisdom that you all are bringing. Any other words that you would want to say right now?
I know for the Moss family, we are still socially distancing. I'm the only one who goes to the grocery store or out to get supplies. Mark and Caden have been here for 6 weeks. For us, when the powers that be do reopen or whatever that wants to be called, I'm still going to stay home as much as we can.
Mm-hmm.
There's so much technology where you can get your worship services and have your meetings, and we're even letting Caden go on Zoom now just to talk to his friends.
That's great. That's great. Well, listen, thanks, Beth. And just a final word to each of you all. There's a great passage in the middle of John chapter 6 where there's a storm that's brewed. Jesus is not with his disciples. They're on a boat. He comes out, and they think not only are they afraid from the storm, but they're also afraid that Jesus is a ghost. And he just simply says, "It is I, don't be afraid." And "it is I" is the Greek word that he uses, ego eimi, and that's the I am statement. And that's God's name. I am, don't be afraid. And I think this is a great opportunity to not let the conversations around us cause greater anxiety. As people of faith, we know that God is present, and that's enough. And this is a really good season for us to focus just on the ways that God continues to be present and to be looking out for those. And then when we spot those, and sometimes we don't spot them, we just have by faith believe that he's there. That is where our confidence is. That's where our peace is. That's where we don't be afraid. So just want to convey that to you all. God be with you all. Next week, we'll have a much more significant medical update coming to you all from that will recap some of the things the medical professionals talked about and what session considered as well. Blessings on the rest of your day, and we'll see you later. Bye-bye.